Important. If you are currently in crisis, please call or text the Suicide Crisis Line at 988 or go to your local hospital. The following presentation is meant to support the mental well-being of nurses, but in no way replaces the need for medical professionals or any prescribed treatments you may require. Admitting to needing help is the first step. Having the insight to seek out medical attention and recognizing the need for help in coping shows your unwavering strength and dedication. It is okay to not be okay. Welcome to the WeRPN Practice Resources, Self-Care for Nurses, Mental Well-Being, Module 1, Stress and Coping, developed by WeRPN with the support of the Government of Ontario. Our agenda for this session will include a discussion on understanding what stress is, the impact of stress, and how to assess stress. We will then review coping strategies and the importance of recognizing harmful coping strategies versus adopting helpful coping strategies. Stress can be defined as the psychological or physical state that results when an interaction between a situation and an individual depletes the resources available for the demands of the situation. Examples: physical can be stress due to disease. Psychological can be stress due to fear. McEwen and Sapolsky, 2006. Stress can occur when an individual does not have enough resources to manage the demands of a situation, an individual is in a situation that is unpredictable, uncontrollable, or has conflict, or there are time-specific deadlines. Periods of stress can occur in some individuals more than others, and in some situations more than others. Michie, 2002. Your body and stress. When stress is acute, we may notice changes in one's behaviors, feelings, thinking, and physical changes. Changes noted in behavior may include becoming withdrawn, aggressive, and feeling unmotivated. Changes noted in one's feelings may include feeling anxious, depressed, being irritable, or increased fatigue. Changes noted in one's thinking ability may include having trouble concentrating and problem solving. Changes noted in one's physical capabilities may include developing palpitations, nausea, and having headaches. Chronic stress may occur when stress is persistent. It can affect your digestive system. One may experience abdominal discomfort as the body begins to slow down the emptying process of the stomach. Diarrhea may also occur when there is increased colon activity. Obesity. Some individuals may use eating as a coping mechanism to respond to stress with an increase in food consumption, which in turn can lead to weight gain. Immune system. When stressed, the immune system begins to weaken, which can result in individuals becoming more prone to infections. Nervous system. Individuals who are stressed may suffer from anxiety and depression related to the perceived or actual threat to the body. This can be exhibited by the inability to sleep and/or decreased interest in physical activity. A decreased interest in physical activity may also lead to obesity. Cardiovascular system. When stressed, the body begins changes that can occur to the cardiovascular system in several ways. There may be an increase in blood pressure and heart rate. In addition, cholesterol, triglycerides, and blood sugar may also increase. When this occurs, it places one at risk for heart disease, atherosclerosis, and stroke. Good stress, known as eustress, can occur during relatively short time periods involving slightly challenging situations. Good stress can also be a motivational force in one's life, as it can attempt to bring achievement to goals and accomplishment. For example, it can motivate an individual to perform well during a job interview. This can be seen as positive in one's life and exciting. Job stress can be defined as the harmful physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, or needs of the worker. Factors that can contribute to a nurse's job stress can include increased workloads, management who are unsupportive, issues with human resources, process of patient turnover, shift work, and relatives of patients. Stress has been shown to affect both nurse educators and students adversely in the education and work life of each respectively. With ineffective coping, stress has been shown to cause nursing students to leave their nursing programs. All students have similar forms of stress, which include a heavy academic workload and exam stress, but nursing students are also faced with additional stressors that are unique to them. Nursing students' practicum courses have been shown to be one of the leading stressors in a nursing student's life. It involves a reality shock related to the workload demands of practice, clinical staff with a negative attitude, experiencing the impact of death, and the anxiety that comes with worrying about making an error in their clinical placement. Nursing educators are also affected by increased levels of stress in the workplace. New nursing educators who are lacking readiness with faculty work expectations, in addition to their teaching role, and including the stressors of being the researcher or mentor for students. There is pressure for some educators to maintain competency in both his or her clinical areas, in addition to their educational role. In addition, educator roles can be quite complex, as technology is constantly changing with new advances. There is also additional demands by students, placing the focus on the educator to provide what is required for their own success. Coping is something that people do so that one can avoid the harm from life strains. Perlin and Schooler, 1978. In order to cope successfully and effectively with a given situation, one must adjust one's own coping techniques for that situation to be able to have a positive outcome. Heffer and Willoughby. When one is able to cope with stress effectively, it can assist individuals in reducing potential negative consequences in one's own psychological wellness. Dykstra and Homan, 2016. In a study done in 2016, it was found that when nurses had a high amount of stress, in addition to poor coping abilities, they had more days of feeling worried, not getting enough sleep, feeling depressed, and suffering from pain. Jordan et al., 2016. That being said, the purpose of coping can assist individuals in reducing the negative consequences that can lead to psychological wellness. Lastly, studies have shown that there is a relationship between one's psychological stress and its impact on diseases. It can be related to the nature of the stress, the number of stressors in one's life, the persistence in how often it occurs, the psychological resources that are available to oneself, and how one has learned patterns of coping mechanism to help oneself. Schneiderman et al., 2005. Categories of harmful coping strategies are shown here. They include avoidance, distraction, chemicals, and violence. Harmful strategies may also include negatively criticizing oneself, aggressive behaviors such as hitting another individual, throwing items, yelling in an aggressive or violent way, eating too little amount of the foods required or too much food, or drinking a lot of coffee or other caffeinated beverages, using recreational drugs, or using prescription medications in a way other than what was intended, isolating oneself, or avoiding one's family and friends. Common coping responses for stress, 2017. Helpful ways of coping may assist an individual to manage or resolve situations. Not all helpful ways of coping listed here will work for each individual. It is important to try a variety of ways to determine which one works best for your specific needs. One must be aware that some coping mechanisms can lead to new stressors, and this depends on the individual. For example, if you decide to go on a holiday to relax, the holiday could lead to a more hectic pace that can lead to greater or more stress. Helpful ways to cope with stress may include listening to music, spending time or playing with a pet, taking part in social activities such as shopping, dining, or going to watch a movie, going outdoors to take part in activities like exercising or gardening, meditation and practicing deep breathing techniques, and finally, see a counselor if the stress persists and becomes unmanageable. WeRPN also offers a variety of resources on our website to assist you in your self-care. This includes a self-care inventory, a goal-setting worksheet, a critical reflection worksheet, and a self-care wellness plan.